mucus, which isn't exactly abnormal. Everything looks to be pretty good. The next thing that I'm going to go ahead and do is I'm going to test for cranial nerve number 5 and number 7. Cranial nerve number 5 is the trigeminal nerve, and cranial nerve number 7 is the facial nerve. So the first thing I'm going to do is the trigeminal nerve. So what I'm going to do is I'm going to take my cotton ball, or I'm going to use a Q-tip here because I don't have a cotton ball, and I'm going to go ahead and have the patient close her eyes and tell me where she feels this. Can you please close your eyes for me and tell me where you feel this? Okay. Perfect. Patient was able to feel where I had the cotton tip. Now I'm going to go ahead and test for cranial nerve number 7, which is her facial nerve. And how I'm going to do this is I'm going to have the patient raise her eyebrows. Can you please raise your eyebrows for me? Perfect. Frown. Show all your teeth. Now puff out your cheeks. And now smile. Perfect. Everything looked great. She was able to use her cranial nerve number 7, her facial. So now what I'm going to go ahead and do is I'm going to test cranial nerve number 1, which is her olfactory nerve. And how I'm going to do this is I have 2 cups right here, both the different liquids, and I'm going to have the patient smell them and have her identify what the smell is to me. Now, can you please smell this for me and tell me what you think it is? Close your eyes, please. Yes, it is coffee. And can you please smell this for me, please? Yes, it is rubbing alcohol. Okay. Now what I'm going to go ahead and do is I'm going to go ahead and assess her lips and her oral mucosa. And we're also going to test for cranial nerve number 9 and 10, which is her glossopharyngeal and her vagus nerve. So her lips are pink. They're not dry. They're symmetrical with the face. She doesn't look dehydrated. The lips don't show any signs of dehydration. So now what I'm going to do is I'm going to go ahead and I'm going to look at the internal structure. I'm looking at the soft and hard palate, and I'm going to see if there's any lesions or bumps that I need to be worried about. Please open your mouth for me. Okay. That looks to be good. Now I'm going to test cranial nerve number 9, which is her glossopharyngeal nerve. And how I'm going to do this, I'm going to have the patient gag. So I would put my tongue depressor in the back of her throat and have her gag. And if she gags, then that means that her cranial nerve number 9 is working. And now I'm going to go ahead and test her vagus nerve, cranial nerve number 10. I'm going to have her say ah for me. Can you please say ah? So you're saying ah. Perfect. Everything's looking good. Now what I'm going to have her do is I'm going to test cranial nerve number 12, which is her hypoglossal. And how I'm going to do that is I'm going to test the muscles on her tongue using my tongue depressor. Ideally, I would be wearing gloves. I don't have gloves, but I would be wearing gloves for this part. And I would check the muscles. I would have the patient move her tongue towards resistance of my tongue depressor. Can you please open your mouth and move your tongue against resistance? I'm going to do that on both sides. This is testing her cranial nerve number 12, her hypoglossal nerve. I would take off my gloves. I would palpate and then take off my gloves and then discard of the tongue depressor. The next thing that I'm going to go ahead and do is I'm going to go ahead and take a look at the patient's neck. I'm going to palpate the lymph nodes. And what minute am I at? 14. Okay. I'm going to palpate her lymph nodes in circular motions with the pads of my fingers. We're looking to see if the lymph nodes are enlarged. I forgot on the trigeminal nerve, I forgot to check for mastication. And how I would do that is I'd put my fingers here and have the patient and then bite down. I'm gonna go ahead and do that. Can you please open up your mouth for me? And now bite down. Good. Okay, so mastication was good. Sorry, I'm gonna go back to assessing the neck area. So I'm gonna go ahead and again palpate the lymph nodes. Lymph nodes feel good. I'm not feeling anything abnormal there. Now what I'm gonna do is check for range of motion exercises. And how I'm gonna do that is I'm gonna have the patient put her chin to her chest, her ear to her shoulder, and then the same for this side, and then have her go in a circle. Can you go ahead and put your chin to your chest? Good. Now your ear to your shoulder. Good. And now the other side, ear to shoulder. And go ahead and turn your head for me. Perfect. The patient's range of motion on her neck was good. Now what I'm going to do is I'm going to test for cranial nerve number 11, which is her spinal accessory. And how I'm going to do that is I'm going to have the patient shrug her shoulders against resistance. So if you go ahead and shrug your shoulders, please, while I give you some resistance. Perfect. And do the same for your face. Push against my palm. Perfect. And now the other. Perfect. She was able to move against my resistance of my palms. Now what I'm going to do is I am going to check her carotid arteries. I would palpate and then I would auscultate. You never do them both at the same time. So I would do one and then the other. And now I'm going to go ahead and auscultate. What we're listening for is we're listening for a bruit, which is a narrowing of a blood vessel. It gets like a sound. So we're going to go ahead and listen to that. So I'm hearing no evidence of a bruit in her carotid arteries. So now what I'm going to go ahead and do is I'm going to go ahead and palpate her trachea and her thyroid gland to see if it's enlarged. So I'm going to go ahead and palpate right here. I'm going to feel it. I'm going to feel her thyroid gland to see if her thyroid gland is enlarged, because that could mean that she has a problem with her thyroid. Thyroid gland and trachea feels good, nothing abnormal. Now what I'm going to have you do, miss, is I'm going to have you swallow. Can you do that for me? Perfect. The patient was able to swallow. Now what we're going to do is we're going to check for skin turgor. In our CPE, I believe it says to do it under the clavicle. I like to do it on the hand, but since it's on our CPE, I'm going to do it under the clavicle. I'm going to do a slight pinch, and it should quickly come back, or else it shows signs of dehydration. Okay. Skin turgor was good. It quickly moved back to her skin. Okay, now what I'm going to go ahead and do is I am going to inspect her upper extremities. I'm going to use this pillow as her arm. So we're always inspecting during this physical exam. So I'm going to inspect it first for color, rashes, lesions, bruises, anything like that. There's no signs of cyanosis, there's no signs of jaundice, nothing like that. And now what I'm going to go ahead and do is I'm going to have the patient perform range of motion exercises. So I would have the patient do, okay, miss, can you please do this with your fingers? Okay, perfect. Now do this with your wrists. Good. Do this with your elbows. Perfect. And now this with your shoulders. Okay, perfect. Range of motion looks good. Now what I'm going to have her do is I am going to have her move against the force of my palm. So what I'm going to have her do is I am going to have her flex and then move against the resistance of my hand. So if she were doing this, I would be moving here and she'd be moving here. So I would check her resistance to check her muscle tone. Everything looks good. Now what I'm going to go ahead and have her do is I'm going to have her rapidly turn her palms up. So miss, could you do me a favor and can you rapidly turn your palms up? Perfect. That looks good. I already performed range of motion, so now what I'm going to go ahead and do is I'm going to go ahead and take the radial and the brachial pulses. So I'm going to do them at the same time to make sure that they're equal bilaterally and that I'm going to check for the strength of them too. So I will check the radial and then I will check the brachial. Okay. So pulses were equal bilaterally and they were a +2.